Thank you very much, Chair DeLauro, and thanks for holding this hearing today. And I'm going to get hyper local here, okay? Dr. Darling Hammond, I'm going to address my first question to you, but let me have a little bit of a lead in, okay? I've held a series of economic roundtables throughout the district that I serve in central and northwestern Illinois. I've done this for a number of years. And the more recent ones, you know what I heard about at every single one of them? It was about teacher shortages, okay? Hyper local here. So what I did, I made a decision to bring together teachers, teachers' aides, administrators, so we could drill down and have a deeper conversation on this issue. And you know what came up at every single one of them at the local level? Social emotional learning. All right, so there you go, it's local. But part of it, I'm gonna drill down then even further about teachers specifically. You know what happens when we don't pay teachers enough, or if we don't provide a supportive environment? People don't become teachers. Or if they do become teachers and we're not supportive, or they're overworked and underpaid, they leave. And when they leave, we're losing staff numbers and we're losing this experience. And that all takes a toll on our kids. So again, drilling down further, that takes a toll on our kids. So our schools really, as I see it, aren't equipped to provide our students the whole learning environment that they need. And as a result, students suffer. Teacher shortages were worsening pre-pandemic. We knew that, we've all seen that. And they've been made even worse by the pandemic. Dr. Darling Hammond, can you please talk about the measurable impact of teacher shortages on the academic, social, and emotional development of children, and touch on how the pandemic has affected these issues as well?
Well, we know that teacher shortages result in several things. They result in courses getting canceled. They result in larger class sizes because you can't hire enough teachers, or they result in people being hired into the classroom who don't have training to teach. And that happens at a large level. It happens disproportionately in higher needs settings. But I will say, for example, in California, about half the people coming into teaching in the last few years have been coming in without preparation. And that means that they're coming in not knowing how to teach math and science and reading. It also means that they don't have the tools to understand child development. And quite often, the disproportionate disciplinary actions and problems like managing a classroom also bubble up. So children are underserved when there are teacher shortages in substantial ways. And just to kind of loop it back around to the questions we've been talking about, one of the things that we need to keep teachers in the classroom and to give them that support is the set of wraparound supports that community schools and other whole child education strategies can offer, which a number of districts and states are looking into, and the Congress has begun to support. When you have health and mental health services there in the school, when you have the social services to help kids, then teachers can create a much more positive environment, and they can help kids get what they need. Teachers burn out also when they can't help kids, when they can't meet all of the needs that they see their students presenting, because that's why they're there. And if we wrap around the teachers and the students with these kinds of supports, you'll see a much better result with respect to teacher retention and student learning.
Very good, thank you. I'm going to try to squeeze in a last question here in the last minute. Dr. Cantor and Dr. Schreiber, if we have time for this, this will be addressed to you. We've seen this siloed approach to addressing certain elements of childhood development. So the whole child approach obviously is important towards breaking down these silos. With developing children's physical, mental, social support all together, we're able to create a more supportive learning environment and be able to address these social disparities that we've talked about today. But the approach of breaking down the silos and addressing disparities is really, we see it as central to addressing social determinants of health. And I know Chair DeLauro knew I would try to squeeze this in. She's been incredibly supportive, as has Ranking Member Cole, in a bill that I have that called the Social Determinants Accelerator Act. We've got grants in that look to empower communities to tailor their approach to addressing these local disparities, which may include better incorporating educational initiatives like the Whole Child program. I'm out of time now. I guess I plugged my Social Determinants Accelerator Act. And I guess I just want to make sure that our panelists know about this, and we'll have to talk about this offline at another time. Thank you, Chair DeLauro, for all of your support of such an important measure, and thanks for holding the hearing today. I yield back.